Well, here we are, Phil. What are we doing here? We're introducing a new podcast today called Pharmacy in Phlux. We're going to explore a number of ideas related to the profession of pharmacy as well as the industry and the business of pharmacy. And we want to stimulate some conversation, some feedback from our guests, as well as some feedback from our audience. And we're going to have a number of guests who we see as thought leaders within the profession and within the industry. And we hope that we can pose some questions to them that will be thought-provoking, perhaps stimulating, and perhaps even controversial on occasion. And the whole idea behind this podcast is to help people run a better pharmacy business as well as be the kind of pharmacists they want to be for their patients in terms of top-notch healthcare professionals contributing to the health of Canadians across this country. So before we get started, we thought that one of the things we should do is let you know who we are and where we're coming from so that you have an idea about what our background is. So why don't you take it away and start and tell us a little bit about yourself.
Well, I started in the pharmacy space many years ago in retail pharmacy, managing pharmacies in a corporate setting. After that, I went off and did my first stint at consulting, usually doing product development and operations. And then sort of leapt into the wholesale side of it, working for a regional pharmaceutical distributor, doing a startup program for independent pharmacies, how I got involved with independence, which was a completely different mindset. And developed value-added propositions for that company, which eventually expanded into 2 provinces. Then because of consolidation, left that company, went to work for a regional player doing the same thing. And then shortly after I began that program, consolidation happened again, which we all know has happened in this industry in terms of distribution. And from that point, did corporate acquisitions for a pharmacy chain in Canada, managing the province of British Columbia. And then from there, decided to retool my business plan and start a succession and acquisitions program, specifically for independents because I built such strong relationships with them. And I just felt there was a gap in that space. Put together programs where you and I connected at Unifarm Wholesale Drugs and did that for a while, and then once that ended, went and did it on my own, and then eventually reconnected with you. And here we are today doing RX ownership. So it's interesting how that all kind of came around full circle.
Yeah, it's definitely a varied career that you've had so far in the industry for sure, and will bring a lot of experience and knowledge and experiences to the conversations that we're going to have in this podcast. As for myself, I'm a pharmacist, graduated from UBC in 1982. Spent the first 13 years of my career as a frontline community pharmacist and community pharmacy manager on Vancouver Island. I then moved back to the Lower Mainland, and I owned my own pharmacy out in the Fraser Valley for a couple of years with a business partner. And then an opportunity came up to go work at the Provincial Pharmacy Association, the British Columbia Pharmacy Association. I was there as the manager of professional services for almost 5 years. And then was recruited away by a regional pharmaceutical wholesale company, did the same kind of job there for a few years, and in 2004 became the CEO of that company. Led the company from 2004 to 2013, and in that, I think one of the things I'd like to note is one of the biggest achievements we had at the company under my leadership was we achieved the status of Canada's best managed companies, and we held that status for 7 consecutive years while I was there. And left the company in 2013, got into my own consulting business called Desson Consulting, and was trying to help small business pharmacy owners with things like business planning and pro forma financial statements and things like that. And you and I reconnected. We never really disconnected.
It's true.
But now I'm participating with RX Ownership as a succession and acquisitions consultant, and continue to have our consulting businesses, and we do an awful lot of work together. And I think between the two of us, bring a lot of experiences. 37 years, I don't know where it's gone. It's been a great ride. It's been a long ride, and I think we've got a lot that we can share with people to help them be better business people and better pharmacists as well.
Absolutely.
So what are we going to talk about in this program? Well, a wide range of subjects, I think, both business issues as well as professional practice issues. And for today, I thought we'd just touch on a couple of things to give folks a bit of a flavor of the kinds of issues and topics that we're going to address in this podcast. Maybe we could just spend a couple minutes talking about why we've named the podcast Pharmacy in Flux, the podcast. And I think, the word flux indicates that things are always moving. And in pharmacy, for sure, that's the case. We've got a lot of movement within the profession, both from a professional practice and a regulatory and a business perspective. And there's a lot going on. And we want to continue to address issues that are current for people so that they're taking into account the right things when they go and make their professional practice or business decisions. So do you kind of agree with that?
Oh, absolutely. It's an ever-changing marketplace. I remember 15 years ago, for something significant to change in pharmacy, it was earth-shattering. It was like, this hasn't happened in years, and now it seems like almost it's a daily event where some other event happens that changes the impact of pharmacy in terms of the business side and the professional side, either through government regulation or some other change in the marketplace.
You make a really good point about how long it took for substantive change to happen 10 or 15 years ago. And I totally get that. I guess the flip side of that is I've been a pharmacist for 37 years, and it feels like I'm still talking about some of the same things I was talking about 35 years ago. And so some things haven't changed a lot from a business or a professional practice perspective. And it's been one of the struggles of the profession. And I think that's a bit of indicative of some of the kinds of things that we can address is, why is the profession like that? Is it the profession itself that is impeding its own growth in terms of scope of practice, for example, or are there outside forces that are kind of beyond the control of the profession that are influencing where we're going and at what speed are we going there?
Well, I think one of the major impactors, not all of them, but certainly one of the major impactors is the fact that pharmacy has a business side to it. It's not all corporate pharmacy or hospital pharmacy. It's independent business owners who are doing pharmacy. And that's a unique space in Canada. If you think how many businesses, small to medium-sized enterprises, are actually funded by the government primarily, and third-party payers, it's unique. And I think that, as a result, has brought about all the flux that we're going to talk about, and certainly seems to be accelerating as the years go by.
Yeah, you hit on a really good point about pharmacy being a business, essentially. And it's really the only healthcare profession that's really run the way it is currently run. And, part of that has evolved because the provision of prescription drugs are not part of the Canada Health Act. And that's been an ongoing discussion, particularly relevant now coming up to, our election here in Canada later this month with regards to a national pharmacare program. And that's been in the news a lot over the course of the past number of months in 2019. And this whole idea of a national pharmacare program. And I think one of the issues with that I certainly have professionally is nobody's really defined what that means. And if you say to any member of the public on any given day, are you in favor of national pharmacare? They may say yes or they may say no, but only in terms of what they perceive that to mean or to be for them. From what I've read and seen and heard from people and talking to people is that they don't really want to give up the kind of benefits they have, particularly if they have workplace benefits and a private healthcare plan now, but they'd like to see a national program that might perhaps supplement that and provide coverage for example, catastrophic drug coverage for a base formulary of drugs that maybe everybody could have access to.
I think the other question is, why a national pharmacare program? And, we go back to this whole issue of an aging population in Canada, and it's certainly impacting the cost of prescription drugs, how many people are now on the provincial plans. I think in BC, pharmacare is over $1 billion annually and expanding. And I'm sure it's like that in other provinces as well. So people don't really understand the impact of an aging population and its effect on the healthcare system purely from a prescription, a pharmaceutical prescription side of the equation. And, that's going to have a huge impact not only for the patient, but also on the supply of drugs and how that's going to be administered through the systems on a provincial basis and the impact it's going to have on independent pharmacy owners and others who are involved in the business of pharmacy.
No doubt, for sure. And, that kind of leads to an issue related to whether or not we're having the ability to continue to meet the needs of the public from a prescription filling perspective, I'm going to say. 10 or 12 years ago, if you took the total number of prescriptions dispensed in BC or in Canada, for example, and divided it by the number of pharmacies, the average pharmacy was maybe dispensing around 35,000 prescriptions a year. Today, that's well in excess of 55,000. So even though we've had significant growth in the number of pharmacies in the country, it hasn't kept pace with the amount of usage of drugs by the aging population, as you indicated. And so each pharmacy on average is filling many more prescriptions because the usage of medications is going up, and that's certainly what's driving up costs, and that's become an issue for insurers, both private and public, and that then leads to a whole nother conversation, perhaps for another episode, around reimbursement and those kinds of things. So we got off on a topic there that maybe we didn't even intend to talk about today, but that's all good and that's okay. One of the things, to give folks an example of some of the kinds of topics that we hope to address and bring to the fore in this podcast, are other issues related to business and professional practice, as I indicated. So from a business perspective, one of the things we're seeing, you and I know this well, is how bearish the market is in terms of succession planning and acquisitions and the turnover of pharmacies. And, it all relates to a number of factors, including the fact that pharmacists, like many other small business owners, are at that age where many of them are considering transitioning out of ownership now. And so where are we going to go with that, and what are pharmacies worth, and how can younger pharmacists get into ownership? A lot of issues there related to what are pharmacies worth and what's influencing values.
Yeah, exactly. And we talk about an aging population in terms of its impact on prescription drugs. Certainly an aging population has an impact. You and I have seen the statistics on ownership. We've got an aging population of pharmacy owners. And so that's going to have an impact too on just how that is transitioned out over the next 7 to 10 years. And just whether there's going to be qualified owners who will step up and be able to take on these established businesses and continue to run them. It's certainly a very dramatically important part of the healthcare system. And value is, again, just a huge component of that. You talked about the increase in prescriptions on average for the pharmacies here in British Columbia, but the value of those prescriptions in terms of what the return is on investment has gone the other way. It's gone down, and that's reflected in the value of the pharmacy businesses themselves. And it's at this point in time, what I find most interesting is that pharmacy owners don't really know what their businesses are worth. Those who are looking to transition out of ownership don't really know what their pharmacy businesses are worth. They all seem to have a mental idea or some kind of concept of what they think or what they'd like it to be, but to really have their feet on the ground and know what that number is something that they're not really looking into. And it's really up to us at this point to try to reach out and to let them understand how important value is.
Well, and the factors that are influencing value. And as you said, and we've had the experience many times where we speak to an owner who's either looking to sell or a young pharmacist who's looking to buy and has no idea about the value of the business that they're really looking at. And our experience has been that owners in particular either significantly undervalue what their business is worth or significantly overvalue it because they put their eggs in that basket and that's their retirement plan kind of a thing. The issue becomes, you mentioned the word qualified buyers, for example, and this younger generation of pharmacists. And I guess we could talk about that in terms of what do we mean by qualified? It's not just whether they qualify financially in terms of being able to access the funding that is needed to buy these kinds of businesses, but qualified just in terms of actually having the knowledge and the ability and the skills and the team to be able to actually run a business as an owner.
Right, exactly. It's sort of going from that romantic view of ownership. I always call it a romantic view where, I'd really like to own a pharmacy business one day. and they never really leave that space. And they just think it's just a matter of being determined and working through the financial side of it, having enough cash on hand to be able to make an acquisition. But it's way beyond that. So many of them, and this is another topic for another day, don't even understand the importance of a business plan, a written business plan, accompanied by a pro forma document that shows just exactly where they think the business is going and why, and all the elements and components that go into that. So it's again, the qualified means leaving that romantic space of saying, oh, I'd like to own a pharmacy, into something feet on the ground with some documentation, with a good group of advisors surrounding them to know how to take that next step forward.
Well, I think that's one of the keys, and you and I have talked about this, and really it's kind of part of our business, is that whole notion of making sure that you surround yourself with the right team of experts who can provide you with the guidance that you need to be successful in transitioning into ownership of a pharmacy business, for sure. I know it's not directly related, but I kind of want to make a point of someone who's observed the profession for 37 years. And that is that, from my perspective, most pharmacists are scientifically minded individuals. To me, it's probably one of the reasons they chose pharmacy as a profession in the first place. And maybe it's not unlike the romantic view of owning a business. It's the romantic view of being a healthcare professional in some way, shape, or form, and medicine or dentistry or nursing or whatever else it wasn't right for them, but pharmacy worked. My experience has been, though, that because of that scientifically mindedness, if I can say it that way, of pharmacists, oftentimes, certainly they're not great business people, and many of them have been successful, what I say, in spite of themselves, because they've been in the right place at the right time. And there was a time in this profession when I refer to it as the golden years, when you didn't really have to do very much from a business perspective to be successful. The system was structured in a way that allowed pharmacy to be financially viable, even without having a great grip on how to run or manage a business. We're not there anymore. Today, you have to be a shrewd business person to run a successful pharmacy business, for sure.
Absolutely. Eyes wide open, for sure, in the space. And, the reason we call this pharmacy in flux is because the changes are happening so rapidly. And it's not just the business itself or the profession itself, it's what's going on around that with government regulation and so on, that is just ramping up change on a regular basis. And again, it's up to pharmacy professionals and pharmacy owners to adjust to that. And it's hard when you're running a business and you're steaming forward and working day to day, trying to build that business and to try to keep up with all the changes that are impacting it as you move along.
Certainly, one of the things that I note with a lot of pharmacy owners is they're too busy on a day-to-day basis working in the business instead of working on the business. And so they don't spend a lot of time in that visionary mode, thinking about where the business needs to go and how they're going to take it there in the future. They're just grinding it out day after day, and they're working, shifts in the dispensary and staying after hours to do the accounting. And it's really tough to run a business that way, for sure, because you really don't have time to spend on where the business is headed and why it needs to go perhaps in a different direction. And as you said, there's so many environmental influences, not the least of which are things like pan-Canadian pricing on generic drugs, for example, which, going back a bit, that's driven valuations of pharmacies down significantly because of the decrease in generic revenue that's coming into pharmacies, for sure.
For sure. And it impacts value. And we talk about value in terms of succession, but it's also value in terms of marketing. If you're in this marketplace that's changing, it's in flux, and you're trying to adapt and adjust your business plan to accommodate all the changes and certainly reductions in revenue, what's your pharmacy worth now, and how is that going to be impacted by your business plan if you're going to make some marketing changes and retool what you're doing in terms of professional services, so on? Is that going to impact value? And how are you going to know that unless you know what your business is worth today? if you start to launch a new marketing strategy for your business going forward from today, it'd be good to know what's worked today and see the impact a year from now on your financial statements.
For sure. You made me think of something else, which is a topic for another day, but just to introduce again the kinds of things that we're going to talk about. And one of the other things that's a big deal, and it relates to valuations and remuneration and where the business is going and all that, is the big dichotomy that exists between pharmacists that are pharmacy owners and pharmacists that are staff pharmacists. And my experience has been certainly that those two groups of pharmacists have significantly different perspectives on a business and how a business should be run and the direction that a business should be taken. And oftentimes there's a fair bit of friction there. And staff pharmacists sort of oftentimes have the view that their pay on payday isn't going to change whether they do this thing, whatever this thing is, or not. They're on a salary or on an hourly wage, and they already feel stressed, they already feel pressure, they already feel overworked, significant demands from patients. Again, another topic, which are how educated patients are these days and the amount of information they have available to them, which makes them significantly more demanding in terms of their needs and requirements from pharmacists and other healthcare professionals. But they just look at these situations that they find themselves in and think, I don't need any more stress in my work life, so I'm not going to do that particular function. And it may be a value added component that might be a paid for service by a patient, for example. The owner, on the other hand, is saying, well, I want you to do that. I need you to generate more revenue for the business because that's the only way I can afford to continue to pay you, to continue to pay increased overhead costs of the business, insurance, give you a raise every year, and invest in technology and infrastructure to keep the business going and make it better and attract more customers. And so the cycle continues. And it's sometimes hard for those two to see eye to eye on how synergistic that relationship really needs to be.
Yeah, it's interesting. We, as you know, get pharmacy professionals registering on our website on a daily basis, and a lot of them are staff pharmacists, either in a corporate setting or independent setting, looking to be in an ownership position. So it'd be interesting to find out the dynamic as to why they want to make that step from being a staff pharmacist to an owner and taking on all that stress and responsibility, as opposed to just being a staff pharmacist. What I find talking to a lot of pharmacy owners is that, number one, they don't have a business plan. They're kind of slinging it from the hip and from experience, and a lot of them have really in-depth experience. But they really don't have a written plan. It's like building a building or a house or something, and you've got blueprints, and you don't share that with your tradespeople. And so the tradespeople don't really know how they come into play in terms of putting this project together. And it could be hugely frustrating and disastrous if you actually built something that way. And I sort of see that being similar in a lot of pharmacy businesses, even in the corporate setting as well. There's that frustration of not having a say or a part, or really knowing the big picture view of what's going on.
Well, that's a really good point. And as you know, a lot of the work I do is in regards to helping people with business planning and writing a business plan and making sure that it meets the requirements of financiers, for example. But one of the things I always encourage in a business plan is for the pharmacy owner and the owner of the plan and the one who's going to be responsible for executing the plan is to involve their staff as much as possible and get input. It's amazing to see how some of the best ideas of all in terms of running and managing a business come from those who are at the front lines every day dealing with patients and customers and what they see. And it's really critical, and they're there, and it makes them feel more a part of the business, which I think is important.
Yeah, and another facet to that too is that if you have good people working for you, and if you talk to owners, they shudder at the thought of losing these people. Is there an opportunity to incentivize them? If you bring them into the big picture view of what the business is and where it's going and why not incentivize them? Why not bring them in that level too, so there's some kind of performance result for them for growing the business?
Well, that makes a lot of sense. And in particular, we have a number of patient-centered services that are cognitive services, I'm going to say now, that are paid for in many instances by private payers or public payers, government. And if they're not being done at all, nobody's getting that money. The owner's not getting anything. And so it would behoove the owner to share that revenue with the pharmacists that are actually delivering the service, because it's new for both of them then. That way, the owner's going to get some of the gravy, the pharmacist is going to get some of the gravy. So shifting gears just a little bit, because I kind of want to get to introducing our first guest on our podcast here. And our first guest is going to be David Pavan, the Deputy Registrar of the College of Pharmacists of British Columbia. And we're going to explore some of the regulatory issues with David in terms of the mandate of the college. And some of the questions that we'll be posing to David are things along the lines like, if the college's mandate in its simplest terms, for me as a pharmacist, for example, is to protect the public from bad pharmacy practice, then what role does the college have to play in things like trying to expand the scope of practice? Does that fit with protecting the public, or should somebody else within the industry or the profession be taking on the lead in advocacy around expanding the scope of practice for pharmacists, for example?
Yeah, I think that's all relevant topics and more that we'll be able to discuss with David during our time together.
Medical cannabis might be another one. I know the college has taken a position that they don't want to regulate anything related to medical cannabis at this point in time because there's no need to do that. Pharmacists don't have access to medical cannabis right now in terms of physical access to the product to make it available to patients. But I think one of the things we've observed over the course of the past year since cannabis has become legal in Canada for recreational purposes is an evaporating of the stigma associated with cannabis for medical use. And more pharmacists are having patients come into their pharmacy and asking for help around accessing cannabis for medical use, what might or might not be appropriate given their particular medical condition, and what role can the pharmacist play in helping them both access a product and make an appropriate choice, and then doing some ongoing monitoring to make sure that the patient's going to perhaps get the best possible outcome, as well as minimize any potential adverse drug reactions related to drug interactions with their other meds and that sort of stuff.
Exactly. And if you talk to a lot of pharmacy professionals today, they're kind of like, I'm not sure I want to go there. I'm not sure where this is going and whether I want to go there, and just the implications or impact it's going to have on their pharmacy business or even them as a professional.
It seems to be that there's a wide range of, the scale is wide in terms of pharmacists at one end and the other end, where the one end is the pharmacists who are saying, I have no interest in it because from my perspective, I don't see enough scientific evidence to support cannabis as an appropriate therapy. At the other end of the spectrum, there are the pharmacists who are saying, well, I think there is some evidence now. We have some evidence in certain conditions, certain specific products in certain doses where it's a second, third, fourth line therapy when other therapies have failed, and it's safe enough that I'm willing to go there because I think maybe there's no other alternative, and so why not try it? And then we've got all the people in between. It's kind of like a lot of issues where you've got sort of the maybe 10 or 20% at each end of the spectrum, and a whole bunch of people in between who really haven't seen enough information to be able to make up their mind one way or the other. And so we can explore that with David and other experts as well.
Absolutely. And is there a business application here? Is there some kind of revenue going to come from the medical cannabis space if I actually bring that into my pharmacy practice? I mean, that's a big question as well. And, all that has to tie into the big picture view of what's going on here, but we probably need a whole podcast just to unpack that.
Well, we will, and there's lots of people who have opinions about that, and so we'll make sure that we get them on to share their opinions with people. But you're right. I mean, the business aspect is a big deal it's a big part of it, and I have to say it's one of the reasons that I've identified that some pharmacists have said to me that they want to get into the business because they see a business opportunity, and it isn't so much necessarily about helping patients. For others, it is, and they have more of a professional bent. Again, it's that spectrum with a lot of people in the middle who don't really know one way or the other. I think the other thing with that is there's risks. A number of years ago, when the federal government was changing the regulations, well before we had this current Cannabis Act and regulations, we had the access to cannabis for medical purposes regulations, and initially we had the medical marijuana access regulations, the MMAR, way back in 2001, and then we went to the MMPR, medical marijuana. It's escaping me now, but it'll come back to me. But anyway, the issue there was at one point in time, the federal government really came to the profession and said, well, what role does pharmacy want to play in this? And pharmacy kind of said, we don't really want any role in this. We don't really want anything to do with it. And at the time, the profession really conveyed the message that there isn't enough scientific evidence for us to be able to support this as a proper therapy. Number one. And number two, I think on an individual basis, a lot of pharmacy business owners were worried about the risk of having cannabis on site physically, because it wasn't legal even recreationally at that point in time, and what potential risks that might pose to their staff, their other customers, security of the business, insurance, all that kind of stuff. Yeah. So there's lots of components to the whole cannabis for medical purposes topic, I guess, for sure. Yeah. Yeah. Thanks very much for taking the time to be with us today. And that wraps up episode number 1 of Pharmacy in Flux. And thanks for watching and have a great day.